Hello, everybody. It's Robert Goldberg here, First Amendment TV, and we're with Joey Rullo doing another segment on political corruption. And today's segment, Joey's going to be reporting on.
What we're going to cover is in commemoration and remembrance of Memorial Day. The VA scandal that occurred in Phoenix, Arizona, at the VA hospital is a disgrace. Right now, what is basically the gist of it, and this is something that anyone who is a veteran knows the nightmare when you come back from fighting hard for your country and the loopholes that you have to wait for to get into the health system, let alone getting your first appointment. What's going on is this has gone back, almost 2 years. And there was a woman by the name of Mitchell who was incoming into the VA hospital in Phoenix. And she had given a warning to the administration there of the hospital that it was a dangerous situation for veterans. And it was ignored. In fact, she was told that her communication skills were not good, and she was basically transferred out of there for doing the right thing. Well, it goes on even further. They tried with smoke and mirrors and a dog and pony show to come up with a digital analyzer or analytical tool to show that the waiting times, or to actually quantify what the waiting times were for the veterans of the VA hospital in Phoenix, Arizona. With that being said, though, the allegations are, and it's out there and there's proof, is that they were fudging with these numbers and they were showing that the wait was not as long. They were trying to show that the wait wasn't as long, but really it was. The big problem is that we have 12 of our brave soldiers who fought for our country, and we remember them today for Memorial Day, who died because the waiting time for your first appointment was over 6 weeks. And in this country, there's emergency rooms, and our veterans don't even have access to these emergency rooms because they're stuck in a bureaucratic system that's broke. And the bottom line is, after Mitchell put herself in a position, she basically put out the information that this was going on in the VA. From there was a formal complaint made, which was supposed to go through McCain's office to the Inspector General of the VA sector, and it ended up going back to the Phoenix VA, basically politics. And from there, all hell broke loose, and it made the mainstream media. I know in New Jersey we have, extensive waiting times, for certain types of procedures. But I know there's a South Jersey hospital, thanks to one of my actually mentors that I look up to, April Kaufman. She was a radio talk show host in Atlantic County, and she was brutally murdered. We're still trying to find out who her murderer is, and she's very, very for the veterans. And basically, she put together a deal that the veterans are able to use the South Jersey hospital, which is awesome. And that's what they're starting to talk about, is that, veterans should have access to, actual hospitals instead of having to wait for 6 weeks to get into a VA clinic, hospital.
The way it is right now, the VA only allows a veteran to get care if they want through a VA hospital. They can't go to a hospital of their choosing, so they don't have the carte blanche healthcare policy that all elected officials have, that they can go into any hospital.
And the biggest joke is a congressman and a senator who has a Cadillac healthcare plan,
correct,
they are able to just show up
anywhere
on a VA base and get health care. So basically, what they should do, Congress and the senators, this is a corruption, political corruption in itself, get rid of their health care. For example, my friend John Runyon from the Eagles, who's the congressman,
right?
He does not take the health insurance, and I really respect him for that. Other congressmen and senators can go directly to these VA hospitals, Army bases, Air Force bases. And the point is not only to get care and to save money for the taxpayers, but they could actually go there and make sure that they ferret out any kind of abuse and waste and anything like this. For example, waiting periods of 6 weeks. Well, that would have been out in the air if you had congressmen and senators that were utilizing it, which is built in. It's built into a congressman's right and their privileges. And that's not a privilege to them. They keep their own health care. But the problem is we have two problems. We have possible malicious intent because this was known by Mitchell, the woman who basically came out and blew the whistle on this thing. She told them that there was a 6-month wait or 6-week wait and told them that this was dangerous. They ignored her cries, and now we have 12 brave soldiers who fought for this country who didn't get care in time and were limited by only the VA hospital. So if there's a position, and I open this to all the elected Congress and senators, that they should immediately sponsor some sort of a bill or whatever you have to do in order so that these VA, they understand, all the veterans understand that if you're in a 6-week wait or a month or 2 months, because this might be viral, this might be bad, this might be in all the different counties, this might not just be Phoenix, Arizona, this could be, all over the United States. They have to put something out there to say to these veterans, if you're going to die, not only if you're going to die, but if you're very sick, this is your other option. And there aren't any other options. Additionally, there was a measuring system that the VA of Phoenix was obviously trying to hide their waiting times for a reason, because there's probably in place quantifying data tools on the federal level that audit them. And they wanted to show them that this wasn't that long of a wait, and they lied. And in essence, 12 soldiers died.
Well,
and I thought it was really important.
But the whole thing really is why was there such a long wait? Why were people waiting so long for care? So what was wrong on their end that they weren't able to treat people just by coming in, like, let's say you and me going into an emergency room so promptly? Why was there so much cover-up going on here? Was it because the administration was under pressure? The hospital administration, I should say.
I think this is the tip of an iceberg. I think that you have budgetary situations where you don't have enough infrastructure, possibly, and professionals in order to meet the demand of troops coming back, and also the overflow of issues that are occurring after they're back. I think that this issue is the tip of the iceberg. They've already, I believe McCain has already basically said that he wants an audit throughout the country at all the VA hospitals. But listen, this is a known thing. Anyone who knows Joey Rullo knows I've been involved with veterans issues for a long time. I worked for the last 2 years helping a veteran who was stuck in a process that was, I believe, intended going back to probably prior to Vietnam, where they would give these veterans 10%. And when you get out of the VA, or after you basically come home and you go to the VA and they're telling you you're getting 10%, that sounds really good at the time. But then when they realize there's a situation where this issue is going to cost the VA a lot of money, I think they calculate what that's going to cost. And initially they were giving about 10% automatic partial disability. Well, where the scam came into place up until a couple of years ago, when I brought up the issue, was that they would put it into an appeal. So here the guy gets back from fighting in the war for his country to try to save his country and give us freedom, and they're given 10%, and at the time it sounds great. But then they realize, wow, I have a very serious problem. I might have Gulf War syndrome where, from sarin gas, or, for example, with Vietnam, with the Agent Orange, which there was eventually a settlement for that. But the bottom line is that appeals process, at one point, a veteran friend of mine was waiting since the Gulf War post to 95. And from 95, I ran into him a few years ago, and we were able to orchestrate through Runyon's office, the congressman who's an Eagle, we were able to push it through, and found out that there are some very serious waiting times with these appeal processes. And I believe initially that when they gave this 10%, that they figured, you know what, give them the 10%. Once they want more money, they'll put the appeals process, and we can hold that money for a long time because it takes years. And there were 3 congressmen, including the one I specified before, that were in office. And he finally got it with Congressman Runyon being in office. So the bottom line is, going back to the VA hospital in Arizona, in Phoenix, this is just like, I believe, with the 10% they gave up front for partial disability, knowing that the appeals process would drag on and on and on, and the VA would be able to hold that money and add it to their budgets for years to come, saving money. I believe that there's the same types of problems. And the federal government, the way it works is they use quantified data on numbers and how long things take. And if the local VAs are using their own data sources and they're fudging the numbers, this could be the tip of the iceberg. And I think that we have to make sure, which there's already been a call, I believe, by Senator McCain of Arizona, that there needs to be an audit individually with all the VAs throughout the United States.
Well, the one thing about this that's definitely for sure, out of all the political corruption stories that we've covered so far, this is the worst, because people have actually died from this.
And a lot of people have died, which it's hard to track. But how many people have had disabilities that couldn't get to the right care, couldn't take care of themselves because they couldn't work and they couldn't get to where they had to go, and they were delayed, just like my friend was delayed and finally received what was due to him in his settlement less than a year ago. So how many people?
So this actually affected not only them not getting health care, their quality of life also.
The quality of life and being able to hold a job, because, how are you able to hold a job when you have a condition?
Correct.
Can't. PTSD is real. Agent Orange poisoning that causes such irreversible problems that for the rest of the veteran's life, they find it, some of them find it difficult after a meal not to have the most horrible situation with the digestive system that you can even imagine. And the government settled for $3,000 for that. Veterans are the reason why we have freedom. And the government needs to focus on them. And we have a lot of veterans coming back, and a lot of them have PTSD. We have the highest suicide rate that we've ever had on veterans in probably the history of the United States and all the wars. There's a ridiculous number of veterans that die every day of suicide. And there's just not enough being done because this Phoenix, Arizona VA shows us that we have major problems in the system that we should demand. And the VA should demand, and veterans should demand, that there be a veterans committee specifically for veterans within the administration. I'm talking above that. Call it No Veteran Left Behind. Because right now, there are so many veterans that are being left behind that, one of the, I forgot which commentator, but, he had it right. Basically, this is a gift, I believe, from God that this was exposed, because this is just the tip of the iceberg. This isn't just during one administration. Okay, veterans have been last on the list for decades. And when you come back from fighting for your country and you're hedged up against odds that are stacked up so that you'll take a 10% disability, knowing that if you take this, they know that it's going to cost them less at the time, and it's going to delay the payment that you're going to get.
Disgusting
look at what's happening
this,
now at this VA.
The disgusting part of this also is that you're talking about 10% here, and Congress, just before this, certain congressmen and senators are looking for a pay raise. Now, if we're not getting the right funding in the VA, you have some real gumption to start asking for a pay raise when veterans are not being treated with the respect and service that they deserve on our end here once they come home to get the treatment that they need.
It's great to go out and memorialize on Memorial Day politicians, but it's another thing to make sure that the veterans have ample health care, immediate health care, not just ample. There's things that veterans have to wait over a year for, and in our country, if somebody's in a position where they're here illegally, within a year, they have all the benefits that a veteran doesn't have. We need to make a change in this country.
Yeah, another thing that was brought up was, I heard on the news that the prisoners in Guantanamo Bay are being treated better than our veterans are. They have access to 24/7 medical attention where our veterans can't even get that.
Let me give you some information. You can make an argument that the prisoners in our jail system are treated better than not only veterans, but most Americans.
True.
It is what it is. And this Memorial Day, I want everyone to remember, this isn't about barbecues. This isn't about a vacation. This is about people that died so that you could have that vacation, so that you could have that freedom. And if you turn this off and go right on and decide that, I'm glad I learned this and that's all you're going to do with it, but what you need to do is you need to make sure that you demand that veterans receive immediate medical care and not even one more veteran dies because they couldn't get medical care. And mark my word, we'll be having another show on follow-up as this scandal grows. And I believe that this is the tip of the iceberg, that there are several counties that are using this same model of quantifying data to meet the specifications of the federal guidelines of expediency. Thank you, and have a great weekend, everyone.
And with that, I'd like to sign off and also ask people if you like what you're hearing and you want to keep up to date on more stories on political corruption with Joey Rullo, subscribe to us on YouTube. Also, you can find us on Twitter. You will see all the information in the credits on where to find us, and keep in touch with us. Thanks very much.
One last thing.
Yes.
One last thing. Next week, Robert will be covering an event that I'm doing for a great cause. Hurricane Sandy was a horrible situation where there's still over 50,000 people that are displaced. And what Robert is going to do is he's going to cover myself. I'm a celebrity host. They're basically building 1,000 homes for people that were displaced from Hurricane Sandy. So if anyone is interested, you can go to building1000homes.com. You can donate and help them out. And at the same time, please make sure you give your congressmen, your senators, your local officials all a call and make sure that this isn't happening your neck of the woods with the veterans.
This information will be in the closing credits and in the bottom on the description on the YouTube page of this video. So if you need to get any of this information, we will have it posted for you. Once again, for another good story, and thanks for tuning in, people. See you soon at our, unfortunately, next scandal or political corruption event, which is a never-ending situation. Take care.